Diabetes is the inability of the body to process sugar in the blood. This has many implications for the person with diabetes. Firstly, sugar in the blood is the primary source of energy that allows the body to function. It also means that high levels of sugar in the blood change the consistency of the blood and can have major complications if left untreated, such as diabetic neuropathy and retinopathy. Type 2 diabetes is the most common form of diabetes and is characterized by insulin resistance. Insulin is the hormone that reduces the level of sugar in the blood. A person with type 2 diabetes is resistant to the action of insulin and needs continuous treatment. This article will discuss what is the treatment for diabetes, particularly type 2 diabetes. Treating type 2 diabetes is often seen as a three-stage approach depending on the tolerance to insulin. The first stage revolves around education. Most people that acquire type 2 diabetes need to be re-educated on a number of things, including eating and exercise habits, controlling their weight and the lifestyle changes that will occur as a result of the condition. They will have to learn that the diet should comprise of 55 to 60% carbohydrates. That the best carbohydrates should be complex carbohydrates like pasta, porridge and potatoes. They should restrict their protein intake to around 30% and their fat intake to 15% of their total energy intake. They need to eat regular meals, about 6 a day but in smaller quantities than before they had diabetes. They should aim to lose weight as this will make their body more responsive to insulin and minimize the diabetic complications and the need for medication. If the patient can implement a diabetic diet, lose weight and exercise regularly, they may not need to take medication. Otherwise, the second stage involves taking medication to make the body more responsive to insulin. For obese patients, the drug metformin is prescribed as it sensitizes the tissues to insulin. For lean people, sulfonylureas is used as it promotes the insulin secretion. If the condition deteriorates, both drugs in combination may be prescribed. The final stage of treatment is where insulin is needed as a replacement therapy. Depending on the individual patient, soluble, fast-acting or prolonged-acting insulin may be used. Ultimately, the patient will have to take insulin via an injection and take some form of medication that acts as a hypoglycemic agent. The aim of early type 2 diabetic treatment is to change the person's lifestyle so that they are not dependent on medication or insulin replacement therapy. However, this is not always possible, especially with older people.